Hi everyone, today we're going to talk about some case study from our clinic with Professor Michael Tyrrell.
Hi, Casey. It's a great pleasure to be back.
Hi, it's my pleasure as well to see you here today. Today, we give priority for the case from a mother had a baby with the skin condition as photo. Can you have a look and tell me a little bit about this condition?
Yes, the mother came with the baby. The baby is a 4-month-old baby with a very severe condition called ichthyosis. Ichthyosis is a genetic condition, and the baby was born with the skin problem. The skin is very dry, very flaky, very itchy, and also there are weepiness on the skin. So it's very distressing for the parents, but also it's very distressing for the baby.
Yes, because the mother had the depression. So can you tell me what's caused the flare-up?
This type of condition is genetic, so we believe that there's a genetic predisposition there, and then the condition gets triggered. In this case, we believe that infection caused the trigger. The baby had a lot of infections right from birth, and that's what caused the flare-up. Now, once it's triggered and it's flared up, then obviously we start treatment of the skin.
Well, I see, but what about if during when mother had the baby, if they go for breastfeeding, is that affect the?
Yeah, that's a very good question because breastfeeding mothers have a big impact on the baby. Of course, the foods that the mother eats can impact on the baby. The mental state of the mother can also impact on the baby because stress affects the mother.
Yeah.
And when the mother is stressed, the mother produces a lot of stress hormones in the system. And then if you're feeding the baby, there would be stress hormones in the milk.
Yeah, it affects the milk.
Exactly, and that can affect the baby. Similarly, if the mother is eating certain foods that can cause itchiness, for example, foods containing histamine can impact on the baby because histamine makes you itchy. That's why people take antihistamine, obviously, to stop the itchiness. So it's very important when the mother is feeding the baby, we have to be very cautious as to what we are doing with the mother.
Yeah.
Because it becomes a two-way treatment, dual treatment. We treat the baby, but we also need to look at the mother and treat the mother also.
This is a very important information about the mother and the baby. If that happens, we need to take care about the mother and the baby as well. It's not only the baby. So, however, can you see what treatment the baby using before came to the clinic?
Yeah, when the baby came to the clinic, the baby was using a lot of over-the-counter medications, had been to, obviously, a dermatologist and been given some very good treatments. But ichthyosis is a genetic condition and there's no cure for it. So the condition can become progressive after a while. So at the time that we saw the baby, he had tried many different treatments, many moisturizers, keeping in mind that they're very little, so you can't give them a lot of severe drugs. So the baby had been using a lot of different moisturizers, which with some benefit, but obviously hadn't cleared up.
How about the results for the baby? I can see after a few months they got the result very clearly, especially on the hair. It's grown up. So what did you do? What have you done?
Well, our treatment protocol, it's very important that we not only look at the skin, to treat the skin, we look at potential triggers that need to be addressed or treated. And interestingly, with this case, we have to treat the baby, like I mentioned, but we also had to treat the mother.
Yeah.
So with the baby, we didn't give the baby a lot of severe drugs, obviously, because he's very little. He was given a very mild moisturizing soap to use to cleanse the skin, and then some moisturizers with bioherbal actives to use on the skin. However, with the mother, we gave the mother some advice on dietary advice, management of stress, because the mother was obviously very, very stressed. And if the mother's stressed, Like I mentioned before, there's a lot of stress hormones in her system, and that potentially will impact on the baby. So all this is very important. So we give the mother a plan for her to manage
Yes.
how she's going to treat the baby.
Yes.
And yes, after 4 months, the baby's had excellent results. It's not a cure, but certainly it's a lot better than what it was before.
I can see the result is very excellent. Yeah, if I'm a mother, I'm really happy to see that.
Yeah.
Yeah, thank you for your advice for the baby and the mother. I think after this one, a lot of mothers, they will know how to take care of the baby.
Yes,
Yeah.
my advice also to mothers with the baby with skin problem is that before they feed the baby, take 10 minutes
To relax.
to relax themselves, quieten their mind a little bit, relaxed, especially if mothers have a lot to do.
They can listen to some music, isn't it?
Exactly.
Yeah.
So do something to relax, like listening to some soft music, and then feed the baby, because you'll get a lot better results because the baby will be a lot calmer. A lot of mothers tell me, especially mothers who are stressed, that after they feed the baby starts crying. The baby starts crying because the baby's been fed with, milk.
I think because the mother, they have the mental health, they get the depression when they do breastfeeding, so that's why they affect the baby.
Exactly.
So the audience, please remember some advice. This is really important, and from Professor Michael Tyrrell. Thank you for that advice.
It's a great pleasure. Thank you.
you.